Hello, hello, hello. Good morning, good afternoon, good evening, and good night. This is Rihanna from the Black Mental Health Matters show. Welcome, welcome, welcome. I hope you're well. And today we have got a very, very interesting subject for you. We're going to be discussing epilepsy, neurological disorders, and how they relate and interact to mental health disorders. Now, I am your host, Rhyana Ebanks-Babb. I am a qualified advocate, mental health advocate. I'm also a qualified mental health first aider, and I am well, and truly involved in youth work around the communities, in educating people on a range of different mental health and social disorders as well. So, we're going to be joined by Tiara Ledette, who's going to be discussing her understandings and teachings around neurological disorders and how they impact on mental health. So, without further ado, I'm going to introduce Tiara to the stage.
Hi,
Hello, Tiara. Welcome, welcome, welcome. How are you?
I'm good. How are you?
I'm very, very good. Very, very good. Thank you. It's a little bit warm today, but we'll survive. We'll thrive.
Yeah,
How are you doing?
I'm doing good. It's also warm where I am in Texas, so very hot.
Well, hopefully we'll survive. We've got our waters with us, so feel free to take a sip when you need to rehydrate. You know. Okay, so welcome to the Black Mental Health Matters platform. Got to get my words out there. Please, Tiara, introduce yourself to our audience.
Yeah, so I am Tierra Ledette. I am the founder of Mentally. And we basically, it's an organization that does like psycho ed in the community. And
Hmm.
basically, the goal is kind of bridging healthcare and the community together.
Hmm.
Um, in my time working in various settings, so I previously worked in neurology. Um, I started to notice there was a very big gap of one being afraid to ask doctors questions,
Mm.
but also just having a lot of general questions about what could have gone differently before they got to a certain point in their disorder or disease, depending on how you want to frame it.
Yeah.
And then it's kind of started to persist when I would just go do things in the community, and people would kind of ask me different questions once I told them what I did.
Mm.
So I started to notice this real trend that even though there's like kind of common information out there,
Mm.
people really didn't know how to kind of make that change in their life,
Yes.
and take those small steps to like really get to a place where they could live a better life with just little lifestyle changes,
Yeah.
which would help their health and mental health a whole lot. So my goal with that is to kind of bring that information to the community. I also work in a private practice, and I serve a lot of marginalized communities. So
Hmm.
providing them psychoeducation when they come in for treatment, and also like teaching them advocacy skills. We already
Mm.
know being Black or brown going through the healthcare system is scary and challenging, and our
Yeah.
complaints aren't often heard. So a lot
Yeah.
of times I'm just walking them through like, this is what you say, like this is what you do. It's
Mm.
okay to get a second opinion. All of
Yes.
those things. So that's a bit about me. I've worked in the field for about 5 years, done a variety of things, seen a variety of things. Yeah, and I'm happy to be here.
Amazing, amazing. So, a wealth of knowledge and experience you can share with us and the audience. I'm sure you will drop us your comments, your questions as we go through this interview. So, thank you, Tiara, for all the wonderful explanation of all the things that you do to help our communities. I noticed that you spoke a little bit about advocacy there, so I'll probably pick your brain a bit about that, being an advocate myself. So, one of my first questions to you, though, so that way we can kind of map out the journey of this conversation. I think it's really important for our audience to have a base understanding of exactly what it is we're going to be talking about. So, my first question to you is, can you please explain what exactly are neurological disorders and what are the most common neurological disorders that you come across?
Yeah, so neurological disorders, a lot of times it can be in the kind of like we kind of think of the body of like two different ways, two different nervous systems. So the like your head, your brain is actually your central nervous system, and your body's your peripheral nervous
Hmm.
system. And so usually it's anything that can affect the functioning of your brain, of your body. Um, a lot of times it's a little bit complicated because sometimes symptoms kind of don't show up in your brain first, they may show up somewhere else. So it's really a kind of full picture of like um, disease that, and a lot of times it's things that you can't control. So it's like a
Mm.
little bit more uh, complicated than just like I have a sinus infection. It's like, trying to figure out where your symptoms are starting from. And I think the
Mm.
brain is a little bit different, and that sometimes that can be a little bit tricky. And what was the second part of the question? I'm sorry.
It's okay. The second part was, what are the most neurological disorders that you have come across?
Yeah, so Alzheimer's disease is pretty common,
Mm-hmm.
of course, and it's not the only type of dementia. I think that's kind of a big misconception people have. There's other types of dementias, but this is the most common.
Mm-hmm.
Uh, there's strokes. So I think most people know about strokes or seen someone with having a stroke. Also, we've seen epilepsy is pretty common.
Mm-hmm.
Even head injuries is something that a lot of people like don't think about, but those
Yeah.
over time have a pretty can put you at risk for other neurological disorders. So head injuries are pretty big as well. And then we
Mm.
kind of have like this combination of like what we call movement disorders, which are like Parkinson's disease, essential tremor, and Huntington's disease. Those are kind of like in that category.
Mm-hmm.
And those are pretty probably well known and common, and there's definitely more that are not well known. Um, we do have ALS, and it's probably not as it's not as popular, but people probably know about it from when people did the ice bucket challenge.
Mm-hmm.
That's what
Mm-hmm.
that was raising awareness for. You have MS, so multiple sclerosis, which affects your body over time, your peripheral nervous system, and even like migraines and headaches. That's also something that's commonly seen in neurology um, that most people experience and
Mm-hmm.
probably don't seek treatment for. So,
Okay. Okay. Thank you. Thank you very much. And this is probably just out of my own curiosity, because I think there's a lot of discussion around neurodiversity. So, do any of the conditions that are considered under the neurodiverse umbrella also fall under this category that we're going to be discussing today?
yes, so autism definitely can fall into this category. ADHD,
Mm-hmm.
even intellectual disability
Mm-hmm.
and global delay, those actually do have put you at increased risk for some neurological disorders later in life.
Mm-hmm.
Um, One of the things that, of course, we know is a lot of times I always explain it to my patients and clients is when dealing with neurodiverse clients is that your brain is just a little different, and we're
Yeah.
trying to figure out how it works so we can
Yeah.
have help you flourish and functioning. And
Yeah.
so, but it does place them at increased risk for certain behaviors as well as like disorders throughout life. So we always try to like give them enough education so they can make the
Yeah.
best decisions as well.
Yeah. Amazing. Amazing. So we'll probably circle back to neurodiversity in a little while, but my next question to you is, what are some of the causes, the symptoms of neurological disorders that people should look out for?
Yeah. So one of I kind of like lump this together. So
Hmm.
one of the big things that most people don't know is that your heart and your brain are interconnected. So we often tell people what's good for your heart is also good for your brain. So a lot of times, what we see in like stroke, for example, there's a very big risk factor um, when we're thinking about cardiovascular disease.
Hmm.
So like untreated hypertension, buildup of cholesterol can lead to a stroke.
Hmm.
Um, Having a sedentary lifestyle, like a non-active lifestyle,
Hmm.
those are all some risk factors. Um, Same thing for Alzheimer's disease. What we're starting to see now is that there's a lot of inflammation in the body,
Hmm.
and that also happens in your brain. And
Yeah.
so we're starting to see a link there, and there's a lot more research that has to be done in that field or that kind of subspecialty. But basically, it's becoming an increasing link that we're starting to see.
Yeah.
Um,
Yeah.
that the more inflammation you have in your body, the more wear and tear it does on your organs. So,
Mm.
of course, some things that lead to inflammation are if you're eating a lot of red meat,
Yeah.
or you eat a lot of processed food, fast food, stuff like that. You're not exercising as much as you can, or you have a little bit more limited mobility with exercise.
Mm.
Um, kind of obesity to a certain extent, diabetes, even alcohol. There's a that kind of like a subset of Alzheimer's where if you are an excessive drinker or
Mm.
excessive substance user, you may have onset of Alzheimer's a little bit earlier on. So
Mm.
when I worked in a clinic, I had a patient who had alcohol-induced Alzheimer's disease, and he was about 35.
Oh
So he was
wow.
very young,
Yeah.
um, and had been coming to the clinic for about 4 or 5 years. So since he was about 30. So things like that, not that you can't have alcohol, but that you kind of are mindful of consumption.
Yeah. Absolutely. Absolutely.
Um,
Thank.
mm,
Sorry. Go ahead.
no, I was going to say also having people watch their stress levels.
Yes.
One that reduces your risk for cardiovascular events like a heart attack or a stroke, but
Mm.
also that helps reduce your inflammation over time. So having good, healthy coping skills and like things you can engage in for stress management are also key.
Amazing. And I definitely agree to that. I remember listening to a neuroscientist speaking about the impact that inflammation in the body can have on the development of a range of mental health disorders. So I can imagine it's linked to the development of and impacts that it has on neurological disorders as well. It was a really, really fascinating discussion. Her name is Dr. Rachel Gow, and
Mm-hmm.
she speaks a lot about foods that you can eat to help reduce inflammation in the body and therefore in the brain as well. It's
Yeah.
definitely one that I would recommend someone to have a look at. Um, so, Tiara, my next question to you is, and this is kind of off the back of you speaking about Black and Brown communities. And as soon as I think of that, I think about access and treatment and diagnosis. And a lot of the time, we're not great at going to seek help when we need the help. So,
Mm-hmm.
um, I think it's really important for us to discuss a bit about the typical diagnostic processes and treatment pathways that people living with neurological disorders may encounter. So, what does that look like from your profession?
Yes, it can go a couple different ways. I've had it when I worked in neurology, for example. A lot of times we would get referrals from primary care physicians who might do like some type of initial exam or screening or get some type of complaint, and then they would refer to a neurologist.
Hmm.
And then, of course, depending, I know in the American healthcare system, different types of insurance allow you different types of access. So sometimes you have to go to your PCP to get to any type of other healthcare provider, and then some people can go directly.
Hmm.
Um, as a psychotherapist, one of the things I see now a lot is sometimes the doctor will send them to me to like kind of talk through like stress management and like things to kind of help with that because they may be
Hmm.
experiencing some physical health conditions. And just based off my own experience, um, I'm a believer in holistic healthcare. So I will often ask them, when was the last time you went to the doctor? What's going on? Like, what are you experiencing? And I kind of do a blend of, yes, I'm looking for this type of mental health complaint or looking at this when you start saying certain complaints, but I also look at
Yeah.
kind of like the other link to that being medical and trying to make sure we're ruling that out before we just say, like, oh, this person has a mental health condition. I'm a very big believer if you treat the underlying cause, then sometimes the other things can go away. So that's one of
Mm.
the things that I advocate for, and I teach patients. Like if we can treat the underlying cause, so sometimes it's not that you suddenly started having mental health concerns, even though that does happen. A lot of times I've seen where it's more of an underlying medical issue of like they have low vitamin D, or they're
Yeah.
going through menopause, or and so that kind of onset their symptoms. So if we treat this other issue, the mental health symptoms can get resolved.
Yeah. Amazing. And I
Um,
think that's very underrated as well, is looking at the whole person, specifically when you are a professional in one area of one person's life, for example, mental health professional or a physical health professional. There needs to be the looking at the whole individual and different aspects that can impact them. So I definitely agree with that approach. So yeah, please continue. Just wanted to second on that comment that you mentioned there.
yeah.
Was there any more that you wanted to add to that question?
No, and just encouraging people to get their physical, like go to your doctor, get your annual physical. Um,
Mm,
that's a big thing that a lot of people, when they're scared of the healthcare system, they avoid it. And I always tell
mm,
people it's better to catch something early than late,
mhm.
always, no matter what it is. So I always tell them like you want to know earlier so you can kind of get the intervention you need earlier. When you get to the point where you're so severe, like there's so much more you have to do, and it can impact your quality of life a lot worse. So
Yeah,
the sooner you get the help, the better. So that's
yeah,
something I often encourage people, like the sooner you know, the better. So don't always look at it as like, oh, I don't want to know. You do want to know so you can do something about it. Um,
absolutely.
and build the healthcare team you want. That's another thing I work with my patients on is like, if you go to the doctor and they're not giving you what you need, and this doesn't always apply to everyone, but mainly for those who do have some form of access,
Mhm.
um, you know, you can pick your doctor like you pick anything else. If you go get your nails done, you don't like the technician, you choose another technician, or you choose another nail shop.
Yeah,
So that's something I always teach people too. A lot of the people I work with are like kind of middle class, and so those folks I really say like it's okay to get another opinion. It's okay to find another doctor. You don't have to stick with this one. Um, so always knowing that that's an option. Um,
yeah,
Also, when they're fighting with the healthcare system, or like they want certain tests done and the doctor doesn't want to do it, asking them to document that in your chart.
yeah,
And a lot of times they will turn around and do it because they don't
yeah,
want the potential medical liabilities that come up if someone else finds something. So that's another strategy people can use, that I want it documented that you don't want to do X, Y, and Z.
yeah,
Um, and a lot of times they'll end up doing it.
yeah. I've used that technique definitely with some of my advocacy clients, especially when in meetings where they've requested my support and they've been to the doctor several times and the doctor has said the same thing to them. All of a sudden, because they've got an advocate present or a secondary person present that may know the system a little bit better than them, they tend to actually fulfill the health request that has been asked of them. So yeah, I definitely agree with that tactic. Be strategic about how you approach these physical health appointments, or even mental health appointments as well, and be armed with the information to challenge. That's definitely one that I agree with, because with the information that we have, we're able to make informed decisions around what next steps we need and want for ourselves. So 100% agree there.
Yeah.
Okay, so I was looking at a bit of research and I came across some information from the Epilepsy Foundation. It mentioned about severe psychological and intellectual issues are not necessarily impacted by biological and social factors. Now, I just wanted to kind of understand what your thoughts on that were, but also if you could explain the link between the development of most commonly reported mental health conditions such as depression and anxiety, and sometimes the perception of a poor quality of life. Um, what's that link between neurological conditions as well as these commonly associated mental health conditions?
Yeah, it really depends. I know, like for example, in movement disorders, sometimes we'll see the onset of depression and anxiety first. So it's kind of part of the how the disorder or disease develops. We may not see we may not see like the actual inability to move or problems with their gait first. So sometimes it's actually built into the pathways in the brain that kind of like that's what shows up first. So sometimes
Sorry to interrupt you, Tiara. I think the internet connection is breaking in and out a little
okay.
bit. Is it possible to maybe start again with what you were saying? Because I'm
Mhm.
losing you just a little bit.
Yes. Um, I was just saying it depends on which disorder we're talking about. A lot of times with Parkinson's, like movement disorders, Parkinson's, Huntington's, depression and anxiety is kind of like within the disorder, and we may see that first sometimes. We may
Mm-hmm,
not
mm-hmm,
see like the effect of on gait, so a lot of times that's what's affected first.
mm-hmm,
So it's just important to ask about family history because
mm,
Parkinson's is unique in that if the person has a recessive allele or like basically the trait, they are probably going to have Parkinson's later in life.
yeah,
So it's important to ask if they have that family
yeah,
history. When it comes to like dementias, Alzheimer's, a lot of times the person become agitated. Like they'll start to notice they can't recall as many things, or they're getting lost in an area where they're familiar, and that kind of increases their agitation um, a bit more. And if people are starting to notice something's wrong, they become a lot more agitated with the person,
mm-hmm,
and kind of like going through a denial phase. Um, and then there's another type of dementia where it actually affects the person's personality.
mm-hmm,
They begin to like become a totally different person. So I had a case where we had like like a 45-year-old male, and like he was very like reserved and quiet and just a hardworking person. Worked every day, all of his colleagues loved him. And
mm,
when he started to have symptoms, he was basically his personality basically flipped. So he was very like loud and boisterous, and he would lose his temper a lot more. And so that's when they started to notice something wasn't right.
mm-hmm,
Um, so different disorders have like a different interface. I think
yeah,
in terms of one thing I often see is that whether it's the patient or the caregiver, a lot of
mm,
people go through grief, and
yes,
it's a different type of grief because they've lost the ability to do certain things and be independent.
yeah,
um, and that is a very big thing we see with kind of the interlink between a lot of the disorders and mental health.
mm,
Sometimes their symptoms, like I said, are woven into their condition, but
mm,
sometimes it's just grief over I can no longer go to work or do the job I was doing. I have to do something different.
yeah,
Um, Sometimes it's I can't drive right now or at
yeah,
all anymore because I'll get lost, or so we try to work on like either strategies that kind of help, like maybe not they drive across the city, but they can drive a certain distance from their home,
mm-hmm,
or using your phone or GPS or having somebody with you. So things
mm,
like that, you really can lose your autonomy and you're
yeah,
over reliant on other people. And of course, nobody, once you become independent, such a big part of who we are as people, um, that can be very frustrating and isolating.
mm,
Um, Also, just a lot of people think about, well, how will the rest of my life go?
mm,
And what will I do then when, if something happens to my loved one, like what's going to happen to me? I get a lot of
yeah.
questions about that. And so we try to do a lot more like planning for stuff like that. It's hard, but it's often like a conversation I encourage people to have.
Yeah, it's important. And I think, when it comes to looking at grief, I know there's the five stages model grief, but there's also the loss and hope oriented models of grief as well. And I'm more veer to the loss and hope orientation because, we go through those highs and lows of feeling that, when we're at the peak of it, we're able to get through. There's hope in our conditions and seeing another side, and looking at life in the new trajectory. But then we go through the lows of seeking that loss orientation, like feeling quite low, quite down, quite miserable about the situation that you're going through. So it's very important, I think, to plan for the grief of what's no longer happened, but also acceptance and commitment to a new way of living. And I
Yeah.
think interweaving some sort of acceptance and commitment type of therapy is important in those types of stages as well. Because, especially if it is something that isn't going to get better, it's only going to regress as time goes on. That acceptance of that continual loss also kind of needs to be factored in.
Yeah, it does. And that's something we do work on, and even trying to work with their caregivers, like whoever
Mm,
their support system is on. These are some of the things you may see over time, and sometimes in preparing them, like there might be a very long time that they're stable and like they're fine, but then there
mm,
might come the day when they're not fine and it kind of start getting worse, and
mm.
preparing them, um, and also preparing them for that shock of like that day may arrive, and being okay with making meaning out of the time that they do have with their loved one.
Yeah, absolutely. Um, a lot of the time, well, I don't know in the US, but in the UK, we call it end of life care. And we support with planning a person's end of life and encompassing all of the cultural aspects, spiritual aspects that may encompass, that end of life support that they might need, making it more comfortable for them, especially whilst they either are in a cognizant state or whether they're not in a cognizant state, and planning for that time when it does come. So yeah, so that kind of leads into my next question, because I think it's important for us to speak about some of the risk factors. I know you touched upon it early on in this interview, but what are the most prevalent risk factors associated with the development of neurological conditions, especially within Black and Brown communities, from your perspective?
Yeah, I'll touch on it in a few different ways. Earlier, we spoke about neurodivergent populations.
Hmm.
And so, a lot of times, women or birthing people when they're pregnant, they're maybe exposed to teratogens, which are like things in their environment that maybe affect their baby's health.
Mm,
So, those we know affect babies when they're born. They're more likely to have a neurodevelopmental disorder.
hmm.
Sometimes it's genetics, but a lot of times we have a lot of environmental exposures that we may not be aware of in our homes, where we live, even like noise pollution, living near highways and stuff like that can affect you.
Hmm.
Um, and then just the things you can control, like, drugs and alcohol exposure, um, also affect a woman, and making sure she's getting adequate nutrition.
Hmm.
Um, and so those are some things that can affect that kind of population where they're kind of at risk because of their pre-existing neurodevelopmental disorder.
Hmm.
In the longer term, for example, people with ADHD, if they're untreated, they're more likely to engage in substance use or just experiment a little bit more heavier.
Yeah,
So it's important that they, like, even if you don't use medication to treat, that you're having behavioral support systems around them to help them kind of uh, modulate their symptoms and like behaviors over time.
yeah.
Um, and then I would say for like the other um, conditions that come along, um, a family history is a very big risk factor. So I always encourage, I know in Black and Brown families and communities, we tend to not talk about our health with our
Mm,
families a lot of times until something happens, until somebody has a stroke or a heart attack. But it's really important that people know their family history, or
hmm.
be provided with information, because you don't want to. There's some things that you can, I would say, kind of be a little bit more on the preventative side of medicine with.
Yeah.
If you know you have a strong family history of cardiovascular disease, like start going to the cardiologist, a little
Yeah.
bit earlier, just out of prevention, making sure you're doing your physical, but just having that provider there already,
Yeah.
um, to kind of screen out, like, okay, these are some of the patterns we've seen before in other family members. Do I show those same patterns?
Mm.
Um, um, Not having a balanced diet,
Mm-hmm.
which is, and I always tell people it doesn't have to be handpicked from the garden. It can just
Yeah.
be something out of the frozen food section. Like, I know inflation right now is a very big thing for people. It can be the frozen food. Um,
Yeah.
it doesn't have to be fancy.
Yeah.
Um, so I always teach kind of like those pillars of like making sure you're exercising. It doesn't have to be 30 minutes straight. It can be, doing squats while you're brushing your teeth. I teach a lot
Mm.
of different tactics of like stacking, where it's like,
Mm.
okay, I'm brushing my teeth, I need to do more squats.
Yeah.
Or if, doing something is better than nothing. So I always tell
Yeah.
people take your time, add one thing at a time. Um, Cardiovascular disease, like I said, sleep apnea. So there's been a link to like sleep apnea with certain neurological conditions,
Mm.
some of which I did name and some that I didn't. It's very important that if you are a snorer, your brain is not getting oxygen when you're snoring. So,
Okay.
so you need to make sure that if you have access to treatment, that you are going to see, are going to get a sleep study, and wearing your mask for sleep apnea so you can sleep and get a restful sleep too.
Mm.
Um, Other risk factors sometimes is age.
Mm-hmm.
Um, Also, the older you get, the more likely some events are to happen. Untreated high cholesterol, untreated blood pressure, um, obesity, diabetes. Even in the south of the US, the southeastern states, we have the stroke belt.
Mm-hmm.
Um, and so we're starting to see a lot more younger people having strokes around their 30s.
Mm-hmm.
So, knowing the signs for a stroke, a regular stroke, but also knowing your silent symptoms of a stroke.
Mm.
If you're having a headache and it's not going away, you're taking medicine, you're doing all these things, and it's not going away, the sign you need to go to the doctor. You could be having a stroke, and that's happened to a family member of mine. He went
Okay.
to the ER actually. He was a marijuana smoker, and because he was a marijuana smoker, he was kind of like dismissed. His like credibility of symptoms was dismissed. But
Mm.
on his CT scan at that time, they actually pointed out that he was having a stroke and just
Wow.
did not treat him. So um, those are some things to look out for, as well. Um, Also, just other things like, if you start to have any type of problems with your eyes, that's another sign something might be wrong. It's
Mm-hmm.
something we see a lot, neurological conditions, either if your brain's swelling or there's a tumor. That's another sign that something could be wrong. You start losing your vision, anything like that. Um, so some things to
Mm-hmm.
look out for. But yeah, drinking alcohol, substance use, inflammation in your body is the biggest one, I would
Yeah.
say. And so if you can eat health, I always tell people when they come to therapy, if you can do the basics of self care, like eating well,
Mm.
exercising, sleeping, and just having social support, you can pretty much avoid a lot of like dementia, some of these other things later in life.
Mm. Amazing. Thank you for that. And something I noticed you didn't mention was stress and trauma.
Hmm.
And
Stress.
yeah, I think definitely if you are able to touch on a bit of about stress and trauma, that would be helpful because especially within Black and Brown communities, we understand that the impact of stress and trauma can have on you know, chronic stress and how that can manifest itself in a range of different conditions. But what's the link between stress, trauma, and neurological development or
Yeah.
disorders?
Thank you for that reminder. Stress over time, one, it does increase your inflammation in your body. Your body
Mm,
can't, like regulate. Your body will always try to regulate itself for the most part,
mm,
unless you have specific like autoimmune disorders.
mm-hmm,
But when you put your body under chronic stress, you do need some stress. So like, you do need it back in the day, like you needed stress to survive, and you still need that today.
Hmm.
Um, but everybody has a different stress tolerance,
Yeah.
and that tolerance can change over time. Especially the
Yeah.
more traumas you've been through, a lot of times your stress tolerance can decrease.
Mm.
Sometimes it can increase, but it's typically going the other direction. Um, but one thing we do know is that one thing I always tell people, Black and Brown people, we often live at a heightened state of hypervigilance
Hmm.
moving through the world than non-Black and Brown people um, or white folks most of the
Hmm.
time. And so it's important to know that even though that exists, that also puts us at increased risk for some of these physical conditions like hypertension, high cholesterol, all this other stuff, because we're already so on edge and tense
Yeah.
because we have to stay safe.
Yeah.
And so um, the more stress management you can do to kind of counteract that, the better, um,
Mm.
because you're already having to move through the world with those extra stressors on your back and the traumas on your back.
Yeah.
Um, Also, trauma is intergenerational. So if you have a mom who's experienced traumas, even before she has even before she has children,
Mm.
that can significantly alter her genetic code. And so we're seeing that that's why we see it being passed down through generations.
Yeah.
And so one thing I often hear a lot is, well, my generation could cope with all this stuff. Why can't your generation cope with it? And so part of that is because it's you literally have um, trauma passed through genes, but over time that wears your kind of like genetic code down a little bit, and you
Mm.
are not as likely to cope with certain things. Um, Even before you consider like other social and cultural factors that exist for that generation. So over time, that wears people down. They're more likely to have certain things onset a little earlier than grandma and grandpa did.
Mm.
Um, it's almost like sometimes even with like what we talk about with bacteria, of it being resistant to treatment, same
Hmm.
thing can happen with genetics. If everybody goes down the line in the family untreated, the last kid may not have that many things that's going to work for them because their symptoms are a little bit more severe. There's that gap. So it's important for sure, especially for us, to have a very good, strong self care toolkit to
Mm.
modulate our stress, to take care of ourselves. Um, and then if I know in Black and Brown communities, especially, we're more likely to be caregivers to older family members. Even in
Hmm.
the face of that, it's so important to take care of yourself,
Mm.
um, more so than uh, with all the other things you're piling on top of you. So, yeah, for sure.
Yeah. Thank you. Thank you for that, Tiara. Um, so my next question to you is, we have a lot of misconceptions around mental health care support and even just the education of how these conditions, as in addition to neurological conditions and their development, we have a lot of misconceptions and stigmas around around these conditions within our communities. In your opinion, what are the most prevalent ones that you think need to be brought to the forefront that are complete myths? Yeah, let's talk about a bit of that for the meantime.
Yeah, I would say one, of course, that therapy is bad, and it's not always. We have different forms of therapy,
Hmm.
some that transcend like talk therapy for Black and Brown folks, but also a lot of times as a therapist, I'm not even sometimes doing therapy. Sometimes I'm bridging them to resources in their community,
Hmm.
or and not every therapist does this, but they're bridging access to resources or information they don't know about,
Mm.
um, that their doctor should know, but they don't. There's that gap in medical education about building kind of like the community aspect of the person to help with the overcoming of like certain conditions or like supports. So a
Hmm.
lot of times that's what we're doing sometimes, and then just providing psycho ed, like I said, on how to navigate the healthcare system and
Hmm.
giving people empowerment to say like, okay, I can pick the provider I want,
Mm,
on my medical team that fits me, that's going to support me. And so sometimes it's just a matter of in helping people work through past traumas with with the medical and healthcare system. That's
mm,
something that we talk about a lot. Is, you know, I went to the doctor, they didn't treat me well. That's made me very reticent to go to any other doctor. And so we work on like, okay, let's find a physician that will support you, and this is what that will look like
mm,
in a lot of cases. Um, I think there's also a level of just not talking about medical conditions at all. Um, and another thing that happens a lot in the Black and Brown community with substance use is that becomes a very heavy coping mechanism, but we often dismiss it. We all have, I guess, the drunk uncle or aunt, and we don't really step in and say, well, why do they drink so much, or what are they really going through that makes them have
mhm,
to turn towards this? Because that raises their risk later on in life for some other things. So it's important that you know, we don't always dismiss the drunk family member, that we actually reach out to them and say, hey, like, I noticed that you're drinking a lot. Is there something going on in your life? And what can I
mm.
do to support that if that's what you want to do, or connecting them to supports?
Yeah,
Um, I think that is a very big thing that happens in our communities as well.
absolutely. I just want to jump in there as well because I think that's where a lot of treatment resistant cases come from as well because they've had such a high threshold to exposure to a lot of these intoxicants. It then kind of progresses that development of anything that could be pre-existing already. So definitely if there is any type of support or even just a person to speak to, if you have someone in your family that is going through some sort of alcohol or drug related misuse issue, definitely start those conversations because you could potentially be saving them a lot later down the line from a lot of
Mhm.
interventions that could have been prevented just from some simple conversations whilst they're going through this quite low depressive state.
Yeah, that's something we see. One thing I've also noticed just in my own life is there usually tends to be like this spectrum of like, I'm not going to go to the doctor for anything, and I go to the doctor for everything.
Yeah.
So finding a balance, and I find this a lot with Black men,
Yeah.
that they don't want to go to the doctor for the things that they need to go to the doctor for at
Mm,
all. And so that can, you know, of course, have deadly consequences, to be frank. And so, like, going isn't going to, it should not kill you, hopefully.
mm.
But I always
Fingers
say
crossed.
go and get the information. Like, you need to know how you're doing. You can't see the inside of your body, so you have to know.
Exactly.
You need to know what's going on and making sure, like, you're okay. Um,
Yeah.
Especially if you have like a history of like cholesterol, cardiovascular diseases, anything that is family history strong. You should just definitely go to the doctor for it.
Amazing. Amazing. Okay, so that kind of helps me smooth nicely into my next question because, um, again, a lot of that kind of stems into the whole umbrella of research for me. And I was reading a brief study by MQ. MQ is a UK mental health research charity, and they speak about most neurological related research is conducted on Caucasian populations. In your opinion, Tiara, why is it important to have a more diverse gene population for the future of research? In order for us to understand the trajectory, treatment, and risk factors of these neurological conditions.
Yeah, we saw this a lot, mainly because if we don't participate, well, one, we have to acknowledge the history of experimentation on Black people throughout history. And
Mhm,
so, whether it's the Tuskegee syphilis experiments or even like gynecological care with experiments on Black women. And so, we
mhm,
have to acknowledge the egregiousness of the healthcare system's history with Black and Brown people.
mhm,
Also, we tend to lack access to those communities, and we're not treated well when we do have access. So, acknowledging that in the grand scheme of things, there's already a broken trust between
mhm.
the healthcare system and the Black community.
Yeah, absolutely.
However, what that tends to exacerbate is we don't participate in research, and so, or we do at lower levels. And so when they're developing treatments for certain things that disproportionately affect us, those treatments may not work on us because they
Exactly.
had no one to test them out on. And
Yeah.
so, um, in some cases, it's just, in some of the research studies are not even intrusive, or you don't have to take anything. Sometimes they're just looking at doing like MRIs on your brain.
Mm.
And so, um, and there's a lot more safeguards now in place to prevent some of that experimentation, or, you know,
Yeah.
making sure you have care if something comes up in their screenings or for
Mm.
testing. So it's
Mm.
important that we do participate in research, because then we know, like, okay, these types of medications don't work for, you know, African American women or men or both. And
Mm.
so we have treatment options there. They're starting to see this a lot in cancer research,
Yes.
actually, where a lot of the cancer drugs don't work on us. And
Mm.
that's because we don't participate in research. So we don't know what will help us. And,
Mm.
and that's why we're dying at disproportionate rates. Part of the reason why.
Mm.
So the more you can participate, and you don't have, you can always withdraw your consent at any point in time if you feel uncomfortable. So you can always say, I don't feel comfortable anymore. I don't want to do it. And that's totally fine. It shouldn't impact your care. But we do have to put another foot forward to participate in research so we know how things can affect us, and
Mm.
so that we have better treatments for us
Yeah.
with certain conditions.
Yeah. Thank you for that. And I'm a big advocate in participating in research. And the reason why I even mentioned MQ is because they are a charity that you, especially in the UK anyway, that you can participate. They have a platform of different studies from several different universities. You can choose to participate whether remotely or like in a physical form. Sometimes you get paid for it, sometimes you don't, but it's more about what you can do to participate in these studies as well. So I highly, highly encourage anyone to get involved. If it's not MQ, then other platforms where you can participate in mental health research as well. If we don't, like you said, put our foot forward, then how are we meant to know? And it's not only for us, but it's for the next generations of people to come
Mm-hmm.
as well. But as you say, we need to know family history. So if we, as current people, don't participate, then for future generations, they won't know the history and the trajectory for themselves as well.
Right.
Um, so yeah, you mentioned previously about resource, and I think that would be a good topic to kind of touch upon as we're kind of rounding out this discussion as well. So I've noticed a lot of discussions around health equity programs, and there's a lot of suggestion around the severe complications that not only children but adults may experience with a lot of neurological conditions. And a lot of this goes down to whether it's poor resource in either low or middle income countries, particularly those that live in rural areas where resource might be quite scarce anyway due to the geographical areas. What do you think can be done to address some of these challenges and the management of neurological conditions in these types of areas, in rural areas?
Yeah, I think it's a bit tricky. I know telehealth has advanced a lot of things for a lot of people,
Mm.
especially more so mental health access. You know, being able to access something from your home versus driving an hour to get there is always ideal and easier.
Hmm.
I think medicine's moving, or has moved at a faster pace with that than us. Um, but also, like, I think in more underdeveloped nations, it's a little bit harder to say, and doing more work of like doing outreach, um, having some type of hybrid situation where they have telehealth, but also like a doctor on site, one, you know, a couple times a month, or a couple times a week. That way they have access to something.
Mm.
Um, it's it's definitely tricky, and one that I can't say a solution to in other countries where they may not have access to the bare bones, like clean water, um, consistent food supply. I definitely think about the hunger crisis right now in Somalia, where kids
Mm.
are starving, and so how that will impact their neurological health because that does impact their brain as well. Um, and so that makes it a little bit more intense of a situation.
Yeah. Yeah. Definitely. And I think just to add on the back of that, we spoke just briefly about advocacy, and a big part of advocacy is campaigning and amplification. So, if you are someone that understands the issues in your local areas, it's very important to advocate and campaign for change in those areas as well, whether it is lobbying to the government for additional resource for healthcare and mental health programs specific to conditions that impact Black and Brown communities. I think that is definitely a way to kind of bring about a health equity or more level playing field when it comes down to issues surrounding healthcare, and kind of what we said before about participating in research as well, wherever you are situated, because it can be something that we can um, create a precedent of international research and information as well. It's not solely within your home country that this information may be helpful and useful. So those are my two suggestions there.
Yeah.
But Tiara, it's been such an amazing and information packed discussion with you. I'm going to ask anyone that wants to ask Tiara a question, please feel free to put it in the comments of the chat. I'm happy to read them out. But whilst we're waiting for any questions to come through, I just want to ask you, what are any upcoming projects for you that we can hear about?
Yeah, so I'm currently in the process of building out kind of like a course platform, if you would call it that, where people can like basically get the same information that I would provide in like therapy with the patient. So some psycho ed elements, stress management, on like well, I'll have something for like caregivers and how
Mm,
they have unique challenges and how to help them navigate those. Um, so that's coming later this year, like in the fall, winter.
amazing.
Um, and so hopefully we'll have it where people can join it like a membership type of deal where they can get access to everything that they want.
Hmm.
But hopefully it'll be interactive and we'll build communities around certain topics.
Hmm.
Um, so that people can have some type of support, even if they don't have a lot of social support in their personal lives, they can have like kind of online social support and helping hold each other accountable to get to where they need to go. That's the biggest thing. And then next year we'll work on like a community partnership program with lots of different organizations to bring people access. There's a lot of different initiatives here in the States. So I'm looking forward to partnering with them to kind of bringing about like those few pillars I talked about, like being active and
Mm,
eating well, things like that. You can always follow us on social media at mentally.org.
yeah.
We always post awareness on mainly on Instagram and Facebook, and then we are also on LinkedIn, so we'll start posting there as well. But we always keep up with like basically awareness topics. So some of the things I touched on today, and like different strategies you can use to kind of help prevent onset or kind of slow onset um, till later in life.
Mm,
Um, and also just giving you some different tips, stress management, self care tips, all of that.
amazing. Amazing. And my final question to you before you go is, please leave us with three nuggets of knowledge or three strategies that anyone that may be experiencing onset conditions of any type of neurological condition, what three nuggets of knowledge do you think are important for them to know?
Yes, eat a colorful diet. So this is something I teach people. Your plate should have lots of colors on it.
Hmm.
And you can always use the concept that I call incremental change. I'm a picky eater myself. And
Hmm.
one thing I challenge myself to every year is to incorporate something new into my diet. So one thing you can try is, if it's you don't eat vegetables or fruit in your diet now, you can just try to eat fruit once a week and then work your way up to it's the certain whatever amount you want per day.
Hmm.
That's something I tell people. Um, get your annual physical. That is so important. And like I said before, you won't know until you know. And using those strategies I mentioned before about navigating, one, trying to find a doctor that fits you as a person, they will respect you as a person, and being okay with getting another opinion. Leaving,
Mm.
you can always leave the doctor's office too. That's something I always tell my patient, and you don't have to stay there. Um, there's
Yeah.
no, you're not handcuffed to the table. So if you feel
Yeah.
like they're not being respectful, you can always get up and leave, and we can talk about finding somebody else. Um, and the third thing I would say is actually a combination. If you sleep well and you're active, or if you're active, you're more likely to sleep well. So those two
Mm.
things are interwoven. So being active, and it doesn't have to be running a mile. It can be walking your
Mm.
dog, 2 or 3 extra blocks, and you're getting in like more cardio. That's very preventative. And so finding little small things to kind of help make little lifestyle changes.
Yes, amazing, amazing. I concur all of those nuggets of knowledge. Thank you so much, Tierra. So we've got one comment here. It just says, Black Goals and Dreams. I love the program from Kangaroo. So thank you
Awesome.
very much, Kangaroo. Glad you liked the show. And anyone else that's listening, just remind everyone where they can find you, Tierra, and we will exit the show here.
Yeah, you can find me at mentally.org, mentalliorg, on all social media platforms. And then I will be doing I'll actually be doing Ask the Founder on Fridays. So you can always send me questions via DM, or even the comments on posts, and I'll answer your questions, any questions you have about the brain, mental health, neurological conditions. And then I'll be doing a monthly column as well on my website.
Amazing. So make sure you subscribe, make sure you follow, make sure you ask the founder, joining those conversations. Thank you so, so, so much. It's been a really amazing conversation with you today, Tierra. I'm wishing you some lovely warmth as well as some cool breeze out wherever you are in the US. And yeah, whoever is watching this, please share with your friends, family that might find this information helpful. Save it if you know that you're going to have to go back, rewind, and take down some of these nuggets of knowledge that Tierra shared with us. My name is Rhyana, your host for today for Black Mental Health Matters. Have a beautiful and blessed day. Take care. Goodbye.